Hi, Dr. Sorrell, how are you doing?
I'm great, thank you. How are you?
Good, good. Thank you for joining us.
Thanks for having me.
And we are going to discuss peripheral artery disease. Now, before we start, if you can please introduce yourself and then the practice that you work with, and then we can start the topic after that.
Great, thanks. Well, first off, thank you so much for having me. It's a pleasure to be here today. I am Dr. Linda Ciavarelli. I'm a podiatrist. I work at Brandywine Podiatry. I've been there in March, I believe, will be 15 years with the same practice, practicing in Delaware. We are the largest podiatry practice, I believe, in the state of Delaware. I have the pleasure of working in our Middletown and Wilmington offices, but we have offices all over the state. So thank you so much for having me. And I'm going to be talking about peripheral arterial disease.
Yes. So now this is because you're a podiatrist, and then usually this topic is, I think it starts with the cardiologist, if I'm not mistaken, right? So we are going to actually look at it from the podiatrist standpoint, and then how you are working with our patients, as United Medical ACO has so many different specialties, serving more than 110,000 patients at the primary care level. And Brandywine Podiatry is a big part of our specialty support. We always appreciate that. And then I think these sessions are also helping patients to get additional information from us. And then we do appreciate that. So I'm going to start our video loop so that you can actually start talking about the topic. And then if I have any questions later on, I will address those with you.
Great, thanks. Yes, it's interesting when you say that the cardiologists typically talk about this. That's one of the interesting things about podiatry is that we see a host of different diseases. We see the effects of them. So thank you for having me on and allowing me to talk about this. Typically, probably discussed by either cardiology or vascular surgery.
So from the disease itself, if you can actually let us tell us like how this works, like at what point patients are coming to you, and what actually it is like. And I know there are a lot of information that you're going to provide for us. So then we can go from there.
Great. Okay. So peripheral arterial disease, or PAD, occurs when plaques, these are deposits of fat in the blood, are inside of the vessels of the legs. People might be familiar with plaques in general around the arteries of their heart, but a lot of people don't know that the same thing can happen in the arteries of the legs. What happens when these plaques are in the vessels is it causes the arteries to harden and narrow. So it's sort of like your garden hose. When you put your thumb over the top of it, it decreases the area for the liquid to go through, and it increases the pressure. So a lot of people are aware of this happening around their heart and maybe even the vessels in their brain, but this also happens quite often in the vessels in the legs and the feet. Other people might refer to this just as poor circulation, and that is another term that's often used. It's very common. It's estimated that 1 in 5, so 20% of the population in the United States over the age of 70 has peripheral arterial disease. That means somewhere around 8 to 12 million people in the United States might have this. The good news is that a simple blood pressure test can detect this. It's called an ABI, and we'll talk about that a little bit later. The risk factors are a lot of the same risk factors that people know about for heart disease, risk factors for stroke, including smoking, sedentary lifestyle, diabetes, high blood pressure, or even a family history of stroke, of peripheral arterial disease. I have some notes here. Thanks. Warning signs. So, this is actually really interesting. Most people that have peripheral arterial disease, they won't have any idea that they're having this. It's been estimated that only a third of people that have peripheral arterial disease actually have symptoms. So you might have this, it might be building up, you might have this buildup of pressure, or these plaques in the arteries in your legs, and you may not even know. By the time a lot of people are having symptoms, there may already be damage to these vessels, and that may or may not be able to be rectified. We'll talk about that. So what are the warning signs for peripheral arterial disease? The most common is cramps or tiredness in the legs. And that kind of presents in two different ways. And this is one of the screening questions that often your cardiologist or your podiatrist might ask you is, are you having cramps at nighttime? Are those cramps occurring more than like once a week? Is it, maybe just, okay, yeah, you do a lot of yard work, maybe you're a little dehydrated, it happens every once in a while, but are you like consistently having cramping at nighttime? And that can be a warning sign. Another warning sign is something called claudication, and that is pretty regular cramping or pain in the legs, either in the thighs or the lower legs, that happens when you're exercising or walking. So oftentimes people will have to stop and rub the back of their leg or rub their thigh because it's hurting when they're walking. And those are definitely warning signs for peripheral arterial disease. Also foot and toe pain that disturbs your sleep. And what's happening is that as we're sleeping, our heart rate decreases, our blood pressure decreases, our muscles aren't moving. And so if you have these plaques, these hardened arteries, the blood may not be flowing all the way to your feet. And that's what's causing some of that pain. And then lastly, wounds on the legs. So we often think about wounds as signs of or associated with diabetes, but you can also have wounds that occur because of peripheral arterial disease. Typically, these wounds are a little bit different than the purely diabetic wounds. So diabetic wounds, and there's a lot of overlap in these wounds, but if you see someone that has, or if we see someone that has a painful, non-healing wound, especially on the outside part of the leg, typically those are because of peripheral arterial disease. So it's just really important. If you're having leg pain, it's not normal, and you definitely need to talk to your doctor. I do want to point out that that's different than leg pain that is occurring all of a sudden. Obviously, any kind of sudden leg pain, sudden swelling of the leg, redness of the leg, shortness of breath, those could be signs of a blood clot, and those would be an emergency. You should definitely seek care right away. Peripheral arterial disease presents a little bit slower. So it's like getting worse over time. And, oh gosh, I was having cramps once a week. Now I'm having them every day. So is it serious? Yes, actually, it is quite serious. Like I said before, somewhere around 8 to 12 million Americans have this. It is associated with heart attack and stroke. And the reason why is because when you have hardening of the arteries in your legs, not surprisingly, you probably have hardening of the arteries around your heart and potentially maybe even in your brain. And that's because there's reduced blood flow in the legs. So people, again, might have that pain when they're walking. One of the most serious effects is amputation. As a matter of fact, diabetes and peripheral arterial disease are the two leading causes of non-traumatic, so meaning like you're not in a car accident or you don't have, something else going on, non-traumatic amputations in the US. And it actually can really decrease your quality of life. So again, if you're having leg pain, seeing your podiatrist, seeing your primary care doctor, or even your vascular doctor, if you have one already, or your cardiologist, these are all people that are equipped to test. So how to test? You can get a pretty simple test. It's called an ABI, and it's a blood pressure cuff that everybody's familiar with. It's typically taken on the arm, And then that same blood pressure is taken on your leg. And then we look at an index of those two numbers. That can give us a really good idea of what's going on and how serious it is. It's a simple test. You don't really even have to go see anyone special to see it. Most of the doctors can do it right in their office. So what if you have peripheral arterial disease? What does that mean? What do you do? So obviously you need to have a conversation with your doctor about quitting smoking. That's one of the leading causes of peripheral arterial disease and is definitely not helping. Also lowering your blood pressure. So taking your blood pressure medications exactly as directed by your doctor and monitoring your blood pressure. Also your cholesterol. And then managing your blood glucose if you're diabetic. Also talking to your primary care doctor or a nutritionist about an eating plan to try to lose a little bit of weight and control your blood pressure. One of the most important things is to get exercise. So one of the common questions that people ask me is, well, I have peripheral arterial disease, so my legs hurt when I exercise. What do you want me to do? Well, believe it or not, there's actually exercise programs out there specifically for people with PAD to help them get blood flow to their legs. Because when you're exercising, you're actually expanding those vessels and helping fight against those plaques that are in there. So how is it treated? It's primarily treated with lifestyle changes. These are, we talked about smoking, exercise, diet, blood sugar. Controlling risk factors for cardiovascular disease, going to see a cardiologist. Lastly, there are also some medications that can be taken, and eventually sometimes surgery is required. Lastly, when you want to discuss peripheral arterial disease with your doctor, just make sure you have your medications ready and your social history. And many people even have like a questionnaire.
So, with these clinical episodes that we have, is one way of really actually learning a lot from what you guys do, and because I do so many of these days, so I train myself to pay even closer attention so that I can actually pick up more stuff. Now, as you know, we do case conferences on a daily basis every morning. There are a group of patients, and I'll just describe them as like patient who has diabetes, and they never have only just diabetes. They have also blood pressure issue. Then they never had that issue. Only two together. They have vascular issues, and they may have chronic kidney problems. These are kind of like group of disease, almost like they're all traveling together or they live together. So like I call them evil sisters. So they are always there with one patient. There are four or five different chronic problems. And what's important, I guess, for our patients is this is one is treatable, but I think getting to the specialist in a timely manner, that makes a huge difference. Do you see that with your patient base, that they're just kind of like waiting until the last minute and then it's already kind of out of control?
That's a great question. There's really a wide gamut. I mean, I do have to say that there were a lot of people in the last couple of years who have delayed care. That's definitely something that's not unique to podiatry. Many people over the last couple of years have really been concerned about COVID and haven't been coming out and being cared for. So maybe have put off care. I have to say in the United Medical ACO, we see a lot of patients that are referred by their primary care doctors that, are in to see us. Many of the primary care doctors in Delaware are really on top of this. And I find that really fantastic that there's a lot of prevention and education going on the primary care level, and then can be sent to the specialist level.
So the other thing is that I guess when we ask patients exercise, they feel like, actually earlier today, I asked Sean, Sean actually is in the same room with me right now. He's not on the video, but I asked him if he works out. And then the expectation, I guess, is like if they are really working hard, like in a way that like they go to the gym every day, spend like 3 hours. That's not what we are talking about, right? When we say exercise, this is just like walking around the block, going to the mall or going to the shopping, grocery shopping. So like just activity like that just keeps them enough in a way that they don't sit like right now, like in this session. So I'm sitting in a certain position. So if I keep sitting on this position for like 2 hours versus if I'm right after this, if I actually get out and stretch and then walk around the building, that makes a big difference, right? So these are like small touches that actually makes a huge difference. So we don't want to overwhelm the patients saying that, look, you have to now work out like 2 hours a day, which is not going to actually even help. So can we just talk about that a little bit? So what's the perception out there from the patient standpoint in terms of the exercise that they have to do?
That's, another great question. Oftentimes people think that when we're talking about exercise, we're talking about training for a marathon or, doing a triathlon or something. That's not in any way what we're talking about. As a matter of fact, the vast majority of our patients in podiatry are certainly in the way that I practice, which is generally general podiatry, is, these are people in 70s and 80s and even 90s and above, and really just moving, walking, making an effort to stand up and move your body once a day. And that actually doesn't even apply only to older people. As our jobs become more sedentary, more computer-based, for all age groups, we recommend, including kids, right? A lot of kids, especially in the last couple of years, we're doing Zoom school. And that was, you got to get up, you got to move around, you got to act, that all counts as exercise.
The other thing that now, because I have my both parents, one 71 years, the other one is 81. So we have to talk to them regarding their health and then make sure that they are actually taking care of themselves. And, my mom, I always use her as my example, and usually it's not a good one. So she never wanted to give up her good shoes, like the fancy shoes. So she said, that's my thing. But then she had diabetes, and then she had blood pressure issues, and then now it's more control. But I think the footwear, at certain point, they need to really give up that fancy shoes and then just get something more healthier, comfortable, right?
Now, you're not putting me between you and your mom, right? Okay. That's a tough question. I also like a pretty shoe, and it evolves with time, right? You have to understand your risk, and making sure that you have shoes that, for the most part, fit you well, aren't going to cause any kind of wounds. I think that's the most important thing. However, I'll say that, if your mom really loves her great shoe and she knows that it fits her well and isn't going to cause any kind of blister or anything, carefully wearing something occasionally.
Yeah. That's a very politically correct answer. Good job.
I have a mom too.
No, this is one of the disease that needs to be diagnosed. But once they are diagnosed, how often do you need to see them in the office? How often the patient should be followed up?
So for peripheral arterial disease, they'll typically follow with a couple of different specialists. So one would be the vascular doctor or the cardiologist. So, the cardiologist kind of does the pump, and the vascular doctor does the plumbing, and some cardiologists do the pump and the plumbing. So whoever it is, whether it's your cardiologist or a vascular doctor is one, and they'll typically be seen a couple of times a year. We'll see them in our office for care as much as 4 times a year. Sometimes, we can, we'll space that out depending on the severity of the disease and the need, and also the risk factors.
All right. So I think again, just like any other disease that I see, being proactive and then taking early actions before it gets to out of control, and then staying in touch with your primary care and with the specialist, following up with those healthcare providers. I think those are the most important parts. So, in a way, you mentioned something earlier with United Medical ACO, the culture, the clinical culture that we were able to build and establish in the last 6 years. The clinically integrated, like meaningful clinically integrated group is what we became in time. And that's part of the case conferences. So when we see the patient with issues like they may have, some of, as you know, like some of our elderly Medicare patients, they are on a limited income and they don't know what's available to them to take care of themselves in a better way. There are different things available in society, in the community, and our social workers are actually helping. And we discuss these in our case conferences. In some cases, we see the patient didn't follow up with the podiatrist. We make sure they get that extra push from our central office. And I think that makes a big impact on the way that we are practicing today. And that actually makes us more successful, and in a way that maybe we are unique in that setting because we are not a hospital system. We are private, right? We are all private groups. So, and being able to do that in a meaningful way, that actually is really important. And I'm really happy that we are able to do that. Anything you would like to add related to this?
I'd just like to reiterate that if anybody is having leg pain, whether it be sudden onset leg pain, which would be an emergency, or a leg pain that's getting worse, thigh pain that's getting worse, it's not normal. And it's definitely something that I would call your primary care doctor about, and have them evaluate you and then see if potentially you should go see a specialist.
All right. Well, Dr. Ciavarelli, you're one of my favorite podiatrists. We know each other for a long time, and it's always great to have you on our episodes. You were part of the diabetes events a couple of times, and I really appreciate you taking time and talking to us. So hopefully we'll see you again in the next couple of months.
Thank you so much. And again, thank you for having me. It's always great to be here.
Thank you.
Thanks.